Have you ever wondered if the pills keeping your heart ticking might actually be fighting each other behind the scenes? Well, modern heart medications are absolute lifesavers. There's no doubt about it. But combining them? That is where things can get a little tricky. Welcome to the Medicine Diary Explainer. Today, we're diving into the delicate balancing act of managing both your blood pressure and your cholesterol. We're going to uncover how the very pills designed to protect your heart can sometimes interact, and exactly what you and your doctor can do to manage them safely. So here's our roadmap for today. We'll be looking at the new blood pressure goals, opening up the medication toolkit, managing cholesterol with statins, exploring that hidden interaction risk I mentioned, how to spot those risks early, and finishing up with safe medication management. All right, let's jump right into Section 1, the new blood pressure goals. The magic number you really need to keep in mind is 130/80. The official target blood pressure for adults is now less than that. But why this specific number, right? Well, the clinical evidence is pretty clear. Pushing that top number, your systolic pressure, down actually slashes your risk of stroke by 27% and heart failure by 28%. It's not just a random benchmark. It's a very precise target designed to maximize your long-term health. But, before we even think about reaching for a prescription pad, your absolute first line of defense is always going to be lifestyle tweaks. Have you heard of the DASH diet? It stands for Dietary Approaches to Stop Hypertension, and it's a real powerhouse. Add in some aerobic exercise, maybe a little isometric resistance training, keeping your daily sodium under 2,300 milligrams and bumping up your potassium. Do all that, and you've got a robust strategy that could actually reduce the amount of medication you might eventually need. Moving right along to Section 2, the medication toolkit. So when lifestyle modifications aren't quite enough, doctors usually turn to 4 major classes of medications to safely bring down the pressure in your arteries. You've got your diuretics, which basically help your body flush out excess water. Then there are beta blockers to gently lower your heart rate, ACE inhibitors to help relax those blood vessels, and calcium channel blockers like amlodipine, which literally stop calcium from getting into your heart and artery muscle cells, helping them open up. And to make life a bit easier, providers often combine these into a single pill, so you don't have to remember to take a whole handful of them. And you know what's really fascinating? Medical science is always refining these tools. Take conventional amlodipine, for example. It is incredibly common, but it has this frustrating side effect for a lot of folks: peripheral edema, which is basically annoying swelling in your ankles and feet. Enter levimlodipine. It's actually the purified, active part of that exact same drug. Studies show you can take a lower dose of levimlodipine, get the exact same blood pressure drop, but with a drastically lower risk of that swelling. It's a fantastic alternative if you're dealing with side effects. Okay, Section 3, statins and managing cholesterol. Now, alongside those blood pressure meds, a lot of people take statins to manage their bad LDL cholesterol. 2 of the absolute heavy hitters here are rosuvastatin and atorvastatin. The real game changer when comparing them is actually how they dissolve inside your body. Rosuvastatin is water-soluble. That means it kind of stays out of your muscle cells. Atorvastatin, on the other hand, is fat-soluble. Because of that difference, rosuvastatin generally triggers way fewer of those notorious muscle aches that people complain about with statins. Plus, it's roughly twice as potent, meaning patients can get away with taking a lower overall dose. Which brings us to Section 4, and this one is crucial: the hidden interaction risk. To really grasp this risk, we have to zoom in on your liver. There's this enzyme system in there called CY3A4. Try to picture this enzyme as a metabolic bottleneck. It's like a single processing lane on a highway. Its whole job is to break down certain medications so they can safely exit your body. So here is where the trap springs. When you take amlodipine for your blood pressure, it actually mildly blocks that exact CYP3A4 processing lane. But here's the kicker. Atorvastatin relies on that exact same lane to be broken down, so with the lane blocked, the atorvastatin basically hits a traffic jam and backs up into your bloodstream. We're talking about blood levels spiking by up to 18%. And that chemical collision? It significantly cranks up your risk of severe muscle toxicity and breakdown. It's a moderate interaction, sure, but it's highly relevant and definitely requires some careful monitoring by your doctor. All right, on to Section 5, spotting drug interactions early. In the real world of clinical practice, overlapping medication schedules can be a huge headache. Take a look at this data from a Stanford study tracking pediatric heart failure. They were looking at 2 overlapping diuretics, furosemide and bumetanide. See those thick black lines where they overlap? Those are literal danger zones, windows of time where the patient is getting both drugs simultaneously, creating an interaction risk that could severely impact their kidney function. And honestly, trying to find these tiny overlaps manually in a complex medical chart is incredibly tedious. But thankfully, this is exactly where modern technology is stepping up. We now have advanced AI systems, tools like Empathia AI, that can instantly scan mountains of medical literature and complex patient records. They actively hunt for these exact overlapping risks, like our amlodipine and atorvastatin traffic jam. And they flag it right inside the intake summary, giving your physician a warning before you even walk into the exam room. Pretty amazing, right? And finally, Section 6. Safe medication management. So, what can you actually do with all this information? Consider this your daily action plan. First off, notice how grapefruit juice is a massive red flag for both of these drugs. It literally spikes medication levels in your blood, so you've got to avoid it. Also, keep an eye on multivitamins with minerals because they can actually weaken the effects of amlodipine. Oh, and here's a really cool best practice. Research is showing that if you take your blood pressure meds at night, you might get better control while you sleep, reducing your overall cardiovascular risk. Beyond that, just make sure you're staying well hydrated to help your kidneys flush out toxins, and always listen to your body if you feel any unexplained muscle weakness. I'm going to leave you with a quick question to think about. Do you know exactly how the different tools in your medicine cabinet are interacting with each other? We've just seen how combinations meant to heal us can sometimes hide some pretty surprising risks. So take charge of your health today, review your prescriptions, ask your doctor about any potential interactions, and absolutely head over to themedicinediary.com for more insights just like this. Stay informed, stay healthy, and thanks so much for joining us on this explainer.